The third question will begin with Mr. Schmidt answering. The Board of Supervisors deals with many healthcare issues. How has your background prepared you to address them? And then, how should healthcare districts participate in the solution to county costs?
Well, in regards to my background, that is actually quite limited in regards to healthcare. I grew up. My mother was actually an administrator for 30 years for a retirement community in Los Altos, where we actually spent a great deal of our time volunteering our time there. So one of the things I do go into is understanding the needs of the elderly, and that's one topic that I don't think we talk about a great deal. So I really want to focus a great deal of my attention in that area. In regards to the healthcare districts, one thing that the health districts do have is, one common thing is that they are out there to improve the quality of life of people. But I think a question has to be raised now is how much more can they contribute to the county that they're not doing so already. And that's a question that I'd like to delve into, as well as the transparency component of it as well.
Memo Morantes.
Great question. Healthcare, we are mandated to provide healthcare for our indigenous residents in San Mateo County, so there's not much we can do about that. We will be experiencing some changes in next year, 2014, with the Obamacare program, if that happens to go through. We're still providing a great service to our community through our healthcare system. In regards to the two hospital districts, they bring in $18 million of revenue annually. And there are talks right now, how can we all benefit, how can our community benefit from those $18 million? Whether it's a collaboration, whether it's putting those money directly into services in our community, I think that's what we're going to be looking into it, because those are $18 million that are sitting there. Now, Peninsula Hospital District actually has $50 million that they're holding. So we got to look at it and really put that money to work where it is supposed to be working, that is providing health services for our community.
Carlos Romero.
35% of our total budget, over $670 million, goes to healthcare. And it's actually, if you think about it, probably a lot of you don't access that healthcare because it is healthcare for the indigent. I do tend to be a policy wonk to the extent that I've met already with Jean Fraser, that I've asked Jean to actually send me, and she has a copious amount of material, certainly addressing the issues of the 2014 Healthcare Reform Act, as well as some of the issues related to how do we actually move to greater efficiencies. We're never going to get away from serving the indigent, nor should we. It is our obligation as human beings to do so. But we can certainly do it in a more efficient and cost-effective way, and I have already started moving in that direction to educate myself, other than the one class that I took at the Kennedy School, to figure out how we do that. In terms of the issue related to the various healthcare districts, I definitely think that we need to work with them so that they actually provide a significant amount of money to address the indigent care need in this county, because that is truly where the county itself is winding up putting in a lot of money. And after 2014, when the exchanges hit, we will see indeed a kind of reformation of the way we have to provide and the economies that come out of that change. Thank you.
Kirsten Keith.
Thank you. On the healthcare issue, I do believe that the healthcare districts need to do more, especially Peninsula. I know Peninsula feels that, or they state that they need to keep their reserves in order to protect against Sutter going under. It's not likely that Sutter is going to go under, and it really is important that the healthcare districts help out. And if Jean Fraser, I've met with her as well, she runs the hospital, she's wonderful. If Jean Fraser asks for a grant for $4 million to help serve indigent clients in the county, then that grant should be honored. It's atrocious when you think that they're sitting on 45 million and we have people who are not getting health care in the county. So we have to help them, and we need to say, you guys need to step up. I'm very familiar with many of the programs in the county because my clients that I serve on I told you I'm a member of the private defender panel. My clients utilize a lot of the services of the county, such as Project 90, Women's Recovery Association, Hope House. These are probably nonprofits that you might not know about, but my clients do. They have drug addiction problems, they have alcohol-related problems, and they need assistance. And if we can get people assistance, we can prevent them from committing future crimes. And that's why the programs are so important. So the healthcare district, we have the hospital that is run in this county, and that's very important. There's also the Ravenswood Family Health Center in East Palo Alto that's very important to continue funding.
Thank you. Andy Cohen.
Healthcare is an essential county function. Several speakers have already talked about that. I support that concept. I do think that there are ways to improve on healthcare, and I think those are things that need to be investigated collaboratively with our healthcare providers, and we need to do the best job we can to make sure that people are getting the care they need. One of the problems with shadow communities is that they don't know their rights. They don't avail themselves of available programs. A supervisor's job is to make sure that the residents, not only in his district, but everywhere in the county, are aware of their rights and avail themselves of services available. I would work hard to make sure that that happens.
Shelly Masur.
Thank you. So as I said in my introduction, I do have a master's in public health, and it's been my commitment all of my adult life to work in that arena. So let me just say a couple of things in respect. You've heard a good description of some of the services that the county provides. About 1 in 7 people in this county get their health care from the county. It's about 100,000 people. With health care reform, we're looking at about another 60,000 people, but I will say that Gene Frazier's estimate is at the moment that it will be cost neutral to the county, so that's the good news. That's one sort of good bit of budget news I'll spread tonight. The county's done a lot of work already in trying to prepare for that and in trying to do things like look at how do we increase our revenues. One very sort of technical example is we've been switching to electronic medical records. That allows us to receive a higher reimbursement rate from the federal government for those people that we're already serving. And we've been reorganizing our county clinics so that people have a medical home so that they receive better services and are less likely to go into the emergency rooms. Very quickly to the issue of the healthcare districts, I think my colleagues have already talked about the differential between the Sequoia Healthcare District and the Peninsula Healthcare District. The revenues come from taxpayer dollars, and they need to be used to support our community.
Warren Slocum.
Thank you. First part of the question was what background do you have in healthcare? I've actually had 2 positions in healthcare. One helping to set up the paramedic 911 program in San Diego County, and the other delivering health care to disadvantaged school kids. And Carlos, both of these were a long time ago. But I do have those 2 experiences and am familiar with health care. I was at the hearing in Sacramento a couple of weeks ago when the topic of these health care districts was heard by Assembly Committee. And it's interesting that one of the health care districts in California actually they use part of their property tax money to fund a gym for the community where police officers and firefighters and other law enforcement officials can get free memberships. So I think that is not the direction for California. I think that I would support the legislation to bring more transparency and to limit the number of dollars that could be spent on administration. One thing in healthcare that's important, John Maltby, the county manager, actually estimates on the revenue side that $10 million could be gained in revenue for the county by better patient accounting, and better billing and collections. Thank you.